Findings from the Centers for Disease Control and Prevention reveal 3 out of every 4 U.S. children were infected with the coronavirus. The study examined blood samples and looked for virus-fighting antibodies made from infections. Thanks for joining us tonight. I'm Elise Ramey. TV5's Kendall Keys spoke with a local physician who shares what the new findings may mean for the future of the pandemic.
It makes me, cautiously happy that there's that much antibody out there, natural or otherwise.
The CDC estimating that 3 out of every 4 U.S. children have had coronavirus. The data collected from 200,000 blood samples that researchers checked for virus-fighting antibodies made from infections, not vaccines.
Not really a big surprise in hindsight that so many kids tested positive for antibodies, and we probably just thought they had common cold.
Dr. Bobby McCamala, a Flint area physician, says about 40% of people are asymptomatic. And even for those that are symptomatic, the younger they are, the more mild their symptoms are. He says natural immunity, while riskier than vaccine-induced immunity, is still good to have.
It's a little bit of rolling the dice, but assuming that the kids are fine now, it's great that there's all this antibody out there.
But he doesn't want that potential natural immunity to dissuade parents from getting their kids vaccinated.
It seems to be about that 90-day mark where the potential sort of drop in antibodies happen. And so it is still a good idea to get vaccinated, and that's to boost that immunity.
He says that is to protect those who are more likely to see severe illness from a COVID infection.
Now we're starting to get back to that interaction, and that's where the risk is. Not so much to the kid, but to the people that are exposed to the kid, particularly grandma and grandpa's generation.
For WNEM TV5, I'm Kendall Keys.
The same report by the CDC also revealed that more than half of all Americans have had previous COVID infections. The White House unveiled new plans to make a pill to treat COVID-19 more available to millions more Americans. The treatment is called Paxlovid and is authorized for high-risk patients as young as 12. The drug is to reduce hospitalization and death from the virus by 90% if taken within the first 5 days of infection.